It all starts with the simulation. So let's get into the technical part a little bit. I'm offering here a system to do cosmetic simulations, starting with the artistry, which is done extraorally in the planning phases, not in the mouth, not ad lib, not as the case is being fabricated. So the artistry part is all taken care of via the pictures before the case begins. After that, it's implement with craftsmanship. Now it's a matter of doing the finest dentistry step by step. Nothing more is required. The artistry is taken care of. The case will develop along the lines that I'm going to show you in a moment. This is the way we used to do cases in our laboratory at Smile Vision, and you can see here the ceramist is making decisions about the case as he's working, except he's missing a little bit. He has no lips, he has no facial features, he has no input from the patient, he has very, very little to work with. Just teeth and his imagination about how it should be. Please don't go along these lines. That's not a good way. Instead, send your models of the case as they appeared in the pictures. This is a detailed, full-scale replica of what's in the cosmetic simulation, very accurate. After this is done, we will call your office and ask you to check out our wax-up. These are preview pictures of the work, and there's a place down here to add your comments, or you can call John Brooks at the lab, talk with him about your case, and if you want any changes. So we preview all cases, wax-ups and final cases, before they're shipped to save you time in the office. Once you've approved what we've done, then we'll make this prep guide for you. This is made over the wax-up, and all you have to do is put your perio probe through the holes to make sure that you've given us enough room to do whatever restorations you're planning to do. So the prep guide will guide you to the correct preparations. Also, after you've approved the case, if you find when it comes to you that you're not sure if you can really prep it, then it's time to go to the preoperative model, prep it over the sink with water, and then put the prep guide on and off. And as you do that, you will learn if in fact you can prep it. And this is for difficult cases. 95% of them are relatively simple, and you'll be sure just by viewing the images of the simulation on our website. Because on the website, the pictures are cropped so that everything stays the same, just the teeth fade in and fade out between before and after. So this is for very elaborate and difficult cases. Now, after you've prepped the case, you're ready to make your temporaries. We have a unique device that works very, very well. Here's your flexible inner layer. Here's your rigid, rock-hard outer shell. The flexible layer fits into the hard outer shell. You fill the device, the temporary template, with isacryl, as I've shown here, careful to avoid bubbles, and press it with a great deal of force against the teeth. The hard outer shell will prevent distortion and of the incisal edges or the facial contours, and will allow the excess to extrude. You can let this set right on the teeth. That's what's done most of the time. Slide it off, and you can see the inner shell is still in place, and there's a thin layer of excess that's flowed over the boundaries. At this point, it's easy to snap that excess off, trim with a Cavitron, and you're all set. Better to leave it at this point, send the patient home. Say to them, I'm tired, you're numb, this isn't the time to tell. Let's talk in a couple of days. In our experience at Smile Vision, we haven't had to change a wax up in many years now. And so that means that we're pretty much on the money all the time. However, each dentist may want to make certain changes. But these temps will reflect exactly what's in the picture. Now you've created a tremendous psychological advantage. because the patient has signed off on the pictures, and now they look like they do in the pictures. It's easy for them to accept this now, and that's why we've had such great acceptance of these cases, which we have over 4,500 done, and in the mouth over the years. The beauty of these cases is that now it's easy for us in the laboratory to duplicate what the temporaries have shown. If the temporaries aren't right, it's very difficult for the lab to make it right by milling. And so the case usually then has to be waxed up by hand, and you're back where you were. But when the temporaries are beautiful the way we're doing them, then it's a matter of scanning, milling, and then giving it to the ceramist, of course, for the final finishing. But what I wanted to point out is notice between the final case and the wax up how the highlights are all in the same place, meaning that the contours are the same, meaning that you've got a case here that when you put it in, you don't have to think twice about it. It's matching the temporaries in facial contour and incisal position. The plane of occlusion is parallel to the eyes. The embrasure between the centrals is exactly where it should be, perpendicular to that line. Again, notice the reflections. They're in the same place on the wax up and in the final case. And in order to do that, you have to have excellent temporaries. And so that's why this template technique that I've been discussing is so important to follow step by step.